So if you take the anterior forearm muscles, totally they are 8 in number. Okay, 8 in number, out of which it is divided into 5 superficial muscles and 3 deep muscles. Out of this 5 superficial, 4 is the exactly over the top layer, and out of which 1 muscle becomes the intermediate layer. So some author says totally 5 superficial. Someone will say on the top layer there are 4 muscle, intermediate layer only 1 muscle is there, and deep layer 3 muscles are there. Now let me put it as this: pronata teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. All these 4 muscles you can remember with the abbreviation PPPA. So you will remember PPPA: pronata teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. So PPPA, that is how you will remember. And if you can remember this, the name superficialis, so that is why it has come to the superficial group. So that is deeper to this 4 muscle. So it becomes the intermediate layer muscle, and all these 3 muscles. The next comes flexor digitorum profundus. You all know superficialis, flexor digitorum superficialis, and flexor digitorum profundus are almost similarly. They are traveling and supply all the 4 fingers. So once you remember the superficialis, now profundus should be obviously deeper muscle. Okay, profundus means it is protruding through the superficialis. When I come to detail of the superficialis muscle and profundus, I will say how the exact orientation of both are there. Now, right now, you just take flexor digitorum profundus comes under 3 deep muscles, flexor pollicis longus, and pronata quadratus. FDS for flexor digitorum superficialis. Over here, flexor digitorum profundus is abbreviated as FDP. This is the exact anterior view of the forearm muscles. So this is your flexor retinaculum. So you see, so it is a connective tissue. It is a thin sheet of band that is going to attach to 2 bones on the lateral side and pisiform and hamate bone. So it bridges the gap and closes the concavity from the top. So below this, all our tendons are going to come to the fingers. So once the muscle is going to contract, the tendon will not come out like bowstringing. Okay, it will be inside this flexor retinaculum, and the movement will happen in the finger joints. So this is your flexor retinaculum. Now let me come to the 5th muscle, flexor digitorum superficialis. This is going to be the second layer. Can I write it as second layer or intermediate layer? Flexor digitorum superficialis is a broad muscle. So flexor digitorum superficialis arises from medial epicondyle of humerus. Okay, so that is from the humeral aspect. From the ulna, it comes to the medial margin of the coronoid process. Thirdly, do you remember there is anterior oblique line? Anterior oblique line. What is anterior oblique line? There is anterior border. It is oblique on the top and vertical on the bottom. That oblique is called as anterior oblique line, part of upper part of the anterior border of the radius. So it is the anterior oblique line. So that is the third origin. So 3 places it comes from: medial epicondyle, medial margin of the coronoid process. It comes down medial epicondyle. Follow my cursor. Second is from the coronoid process, medial margin. There is a line, oblique line. So that is the anterior oblique line. That is the third origin. So it comes down, it splits into 4 tendons for each fingers. Okay. At the level of the proximal phalanx, it is going to further split into 2. And it comes to the middle phalanx and attaches on either side of the anterior side surface of the middle phalanx. So what is the insertion? Sides of the middle phalanges of medial 4 digits. It crosses the wrist, it crosses MCP joint, it crosses PIP joint. So the action will be, it is going to mainly flex the PIP joint flexion, but because it crosses MCP, you can also see that it is going to do MCP flexion and it can also give you wrist flexion. So these are the actions. It mainly serves the PIP because it bypasses all these joints. It can give flexion to the wrist also. It can give flexion to the MCP joint also. Okay, it is supplied by the median now. So here is your Flexor Digitorum Superficialis. So where all it arises from? It arises from the medial epicondyle of humerus, and from the ulnar it is going to arise from the top medial margin of the coronoid process. Anterior surface is from the brachius. So medial margin is over here, and there is a line of origin here. This is the anterior oblique line. So 1, 2, and 3 origin. It comes down. It splits into 4 tendon. It passes beneath the flexor retinaculum. It is there. It is going to go under the flexor retinaculum. 1 for each finger at the level of the proximal. What is this? You see second proximal phalanx. Okay. So this is the metacarpal bones. These are the proximal phalanges. Okay. Over there it splits into 2. Now it comes and inserts at the side of the middle phalanges. Okay. Now let me show you the side view. So this splitting is going to give bypassing, the bridge shape, tunnel shape for the profundus. So which means below the superficial muscle, you will have the profundus, the tendon comes similar to that, and between in this splitting, the profundus muscle is going to come out and insert there. Why you want the splitting here at the middle phalanx? You will have the profundus muscle tendon. 4 tendons will come like that. It will cross and go to the distal phalanx. Okay. So let me just revise this. It comes from the medial epicondyle. It comes from the medial margin of the coronoid. It comes from the anterior oblique line. It goes beneath the flexor retinaculum. It splits into 4 tendons, 1 for each finger. At the level of the proximal phalanx, it is going to have the splitting. It insert at the side of the middle phalanx. Remember, now that you have known what is Flexor Digitorum Superficialis, deep muscle will be Flexor Digitorum Profundus, FDP. Now let us see where it comes from. So it comes from, now all these muscle will not come from the medial epicondyle of humerus, because these are deep muscles. They will come from the surface of the radius and ulna. Where they will come from? Deep muscles will arise from surface of ulna and radius. This you need to remember. Because they are deep, they are just going to sit over the surface of those bones. Okay. Now, what is the origin of the FDP, Flexor Digitorum Profundus? Upper 3/4 of maximum area. Upper 3/4 means what? On 4 surface, it is going to cover 3 surfaces. So it is almost 75%, 80%. That is what it means. 3/4. Okay. So upper 3/4 of anterior and this side, medial side of the ulna. It comes along the beneath the superficialis it is going to penetrate through the two slips of the superficialis and insert at the base of the distal phalanx of the middle forefingers, because it is going to supply the DIP flexion. What it gives you? DIP flexion. What about this PIP, proximal interphalangeal joint, MCP, wrist? All this flexion is also possible, but this is secondary. Primary movement is at the hip, like this. It is because this is deep. You have this anterior interosseous branch of median nerve. The anterior interosseous branch is the deep branch. On the top, it continues as median nerve. It gives a deep branch called as anterior interosseous. Why interosseous? It lies on the anterior interosseous surface. Interosseous membrane is there, yeah, it comes along it. So this is the deep branch. This, because this is the deep muscle, there are only 3 deep muscle. Very easy. Anterior compartment is very easy. Only 3 deep muscle. One is the profundus. So you can take the entire 3/4 surface of the anterior surface of the ulna, and it can also take the medial surface of the 3/4 of the ulna. Okay, so these are the 2 areas it comes. Now you see it has 4 slips. It comes beneath the flexor retinaculum. It goes for every finger, and over here it comes and inserts at the base of the distal phalanx. Now the yellow shaded is superficialis, and now this yellow is the Flexor Digitorum profundus. It comes through the split and it goes to the distal part of the fingertips. That is the distal phalanx.